Hi everyone, Physician Assistant McKenna Duquette here, and today I wanted to talk about reasons why people may find it difficult to manage chronic conditions. I think one of the things that comes to mind for me, especially based off of what I've witnessed in my current area of practice, is just a generalized lack of understanding that patients may have in the first place in regards to what their disease state is, what medications they're taking, what that medication is doing for their disease state, and etc. I think that I've experienced countless moments where I've asked a patient, what medications do you take? Why do you take them? And there's been plenty of times where patients are completely unsure of why they're on a statin. I asked them, was your cholesterol high? Oh, my doctor just told me to take it based off my labs and whatever. There's not really much of a deep dive there on the practitioner's end to explain to the patient in depth as to why that medication is being started, or what disease state they're trying to modify, or what value they're trying to change. And I think that that's something that needs to be fixed on the provider's end, taking the time to be able to discuss with patients why medications are being started, things that could help outside of the medication in order to correct that disease state and whatnot. I think too, there is a level of accountability on the patient's end of wanting to learn and know those things so that they can make changes on their own in their own life and health journey to be able to better themselves and maybe be able to come off of that medication. But I think in general, being able to support patients in heightening their health literacy would be very big in terms of making them feel like they have more of a tangible grasp on how to manage their chronic conditions by just giving them foundation of understanding what's going on in the first place. Because obviously the medical world is very overwhelming. So being able to lend as a practitioner and as a patient, both working towards in heightening health literacy and understanding baseline what's going on, I think would help people to feel like managing their chronic condition is less overwhelming.